These days we have drug-resistant syphilis and gonorrhea. It's a nightmare.
We are also aware that young people are engaging in unprotected sexual intercourse at unacceptably high rates again.
Kwa sisi kama majenzi, mtu anasikianga tu fiti eti amegongea mse mwingine.
Kama tu kugongeana si mzuri juu unapata mwingine maybe anaweza kuwa na magonjwa.
The Kugongeana stuff, it's there.
Hii mambo ya kugongewa and stuff like in Nairobi you don't have one partner, like you are sharing. Yeah, it's something they have normalized.
This is the world of Kenya's Gen Z and Millennials. A world of endless connection, curated identities, and unprecedented sexual freedom. A world where tunashare, kugongeana, aura affirming threesomes, and orgies have become the new vocabulary of intimacy. Beneath the filters, the flexing, and the fearlessness, a silent epidemic is spreading. Not a new virus, old enemies. HIV and sexually transmitted infections are finding fertile new ground in a generation that thought they had escaped the scourge.
At 83% of the adult new infections that occurred in the year 2024 occurred amongst children, adolescents, and young people aged between 15 and 40 years. So it is a warning shot for us, because when you have a young population which is bearing the burden of the new infections, it means that we will have a cohort that runs along the age core, along the years to come, into the future, which has to be on treatment.
The question we must answer is, have we traded freedom for madness or being cool?
Behavioral changes has increased the prevalence of STDs. Poor health-seeking behaviors have also done that. And when I say behavioral issues, I think we have a lot of transactional sex in our society. It's something that we have allowed. We tell women that is being an independent woman. We tell men that so long as you have money, you can get any kind of woman. And because of this transactional sex, we have inconsistent use of condoms and other protective measures that can prevent people from getting this kind of diseases. So the behavioral issues that we have are, number one, transactional sex, poor health-seeking behavior, and honestly, I don't think that the young are afraid of diseases as much as they should.
The official data is clear. HIV infections are declining nationally. But among young people, especially Gen Z, the curve is bending in the wrong direction.
But these numbers are not numbers that are scary numbers. They are not numbers that are in any way meaning that we are reversing the gains. We are not reversing the gains. We have made significant progress. But what we are saying is that we are not flattening this curve of new HIV infections fast enough as we hoped.
You don't live once. You live every day, but you die once. Every single day you're living, you die once. So that's not the way you should look at life. Secondly, I understand it's exciting, there are women around, there are dudes around, sex can be fun, all that is good. But know that you're free to make that choice, but you're not free from the consequence.
STIs like chlamydia, gonorrhea, and syphilis are exploding.
Unfortunately, the reporting of STI infection in Kenya is suboptimal. You find that there's a lot of what we call syndromic treatment. Syndromic treatment is if you come, you have some penile pains and some secretions. Even before we confirm at the laboratory, the WHO has an approved algorithm which allows you to be put on treatment so that you do not develop further conditions of that infection. So most of them, actually, they go unreported or undetected.
According to NSDCC CEO Douglas Bosire, statistics show that the majority of Gen Z are deliberately not using condoms. That single behavior is the biggest driver of new HIV infections and the STD prevalence we are now seeing.
We are also aware that young people are engaging in unprotected sexual intercourse at unacceptably high rates again. How do we know this? Common evidence is when we look at the number of pregnancies that the country records in a year.
The government first detected this careless behavior through another indicator, the rise of pregnancies. Bosire explains that this generation simply cannot relate to HIV. They have never seen the scourge. They never buried relatives. They never watched friends waste away. So they fear pregnancy more than they fear AIDS.
People whom we have today, whoever was born in the year 2000, really never witnessed the peak of this epidemic, never witnessed the pangs of the full-blown HIV disease. As a result, unfortunately, among those 19,991 new infections that I'm talking about almost 4,300 occurred among children aged between 0 and 14 years. Above 15 years, which we refer to as adult infections, we had about 15,600 new infections. Unfortunately, out of those 15,600 new infections, 41% of them occurred amongst adolescents and young people aged between 15 and 24. If you expand that bracket a little bit to 35 years, to 34 years, you find that almost 75% of the new infections that occurred in that year occurred amongst young people and adolescents aged between 15 and 34.
Their knowledge levels for preventions are dangerously low. Why? Because international partners withdrew funding for robust sensitization campaigns.
We were losing in an unacceptably high number of lives due to AIDS-related illnesses, and the government then, under the leadership of the late His Excellency President Daniel Toroitich arap Moi, declared this to be a national disaster. We were losing upwards of 700 people, 700 Kenyans per day back in the day.
Young people don't know how to protect themselves, where to get tested, or how to start treatment.
When we talk about it and when we put out these statistics, sometimes they might be misconstrued or misinterpreted to mean that the new infections are actually increasing amongst this cohort. No, what we are saying is when we are granulating the data, this is the population that is most affected with the new infections. And if you do not close the tap of the new infections, we'll be mopping the room, but the tap is running. And therefore, we'll be doing a zero-sum game.
Honestly, in my practice, I have never seen even one couple come to test at just before they have sex. Never. It's always after, when washapata kitu, when things are burning and hurting, they have some pimples and whatnot in places that they didn't have pimples. That's when they come to us. They never come to us before, and that is important. You need to get tested. First of all, have self-respect. Have self-respect, have safe sexual practices. Secondly, don't trust anyone until you have tested them. Be there for the test, have the test done, get some counseling, and then go on with life. But when you tell people that, wanakuambia inakuanga ni story ya moment. Your moment ikipita, imepita. But let me tell you, that moment, those 4 minutes can cost you your life.
These young people who were born post the 2000s never saw somebody truly living with AIDS as a disease. So they do not relate with AIDS, but they can relate with a pregnancy. Because anyone who's living with HIV today looks like you and me. Because we are people on lifelong, life-saving antiretroviral treatment. And as a result, because they do not know the seriousness of the end result of an HIV infection, they sort of tend to fear, pregnancy more than the virus.
The government now admits it must venture into the social spaces where young people find comfort, online, on TikTok, on Instagram, on Snapchat, to have intellectual discourse without judgment. But first, they have to give young people a reason to act.
And we interact with them in their spaces on a continuous basis because we are trying to reach out. We are trying to reach out to them. So first of all is that the fact that they do not relate. Number two, according to the Kenya Demographic Health Survey of 2022, it clearly showed that among these young people aged between 15 and 24, there's a want of knowledge on HIV prevention.
Social media brings both good and bad. Dating apps have made random sexual partners available at the click of a button. Bosire notes that peer influence online is now stronger than any one-on-one conversation a clinic can provide.
When HIV was at its peak, we had a lot of public education, advocacy, sensitization, and awareness efforts, and most of these were funded by our partners. But since over time, the overseas development assistance that we have been receiving as a country has been over time dwindling. So as a result, those intentional, deliberate, large-scale, robust sensitization that we had are no longer there. And as a result, the young people really do not know about this virus. They do not know how to prevent themselves about this virus. They don't know the advantage of getting tested as a routine practice so that you can be put on care. And, hence these casual sexual engagements, even with multiple partners, which end up predisposing one to not only infections of HIV, but to pregnancies and the other sexually transmitted infections.
So a lot of the youth are falling into that peer pressure. They want to look cool, they want to feel cool, they want to be adults, but they don't realize that sex comes with consequences, and the consequences is what they are not ready for. So I think it's from home, the society, and even the teaching within the schools. Nowadays we are too sensitive. We call them, the millennials like to call the Gen Z's Cerelac babies, the Indomie babies, because you tell them something small and they are immediately offended. Reality does not care about your feelings. You will get that STD if you don't take care of yourself.
Habari mbaya zimenifikia, mandugu zangu wananikulia, kumbe sahani yangu ni sinia na inaniuma sana. Nairobi, yule anakupea pia ananipea, akikuletea ananiletea, wanakula fea, sote tunashare.
Music and pop culture have normalized careless sexual behavior, and the government response must use the same channels to normalize protection.
What we are trying to do as a council and as a government is to say that is not our role alone. We cannot be able to change the behavior, the societal habits, the negative cultures of communities if we just speak as a government. We have to bring all the stakeholders on board.
For sure there is a huge gap. You see, the country has decided to get community health workers who are not trained in the medical field. They are taken, they do a course. If they do a course, it's not lengthy, it's not enough. You cannot learn medicine in a week or 3 days or a month. You have to go through the process for you to even understand how these diseases come up. So the community health workers that they've placed out there, siko ubaya, but they are not helpful. We have a lot of clinical officers and nurses who don't have jobs. If those people are taken to the villages and to the community and they are told to teach people, I think they'd make a bigger impact. Number one, we need that. We actually need to allocate money for sensitization of different diseases in our countries, especially something that's affecting the youth, because STD's highest prevalence is for patients who are under 25 years. These are people who are the most productive. This is the future of the country, and they are riddled with STDs. We need to take care of that. We need to educate them from school, even from primary school. You're taught this is how things are, this is what puberty is, this is what sex is, this is what is expected of you, things like that. We don't have that sensitization.
Dr. Patrick Amoth, the Director General for Health, puts it bluntly: the health risk isn't the label, it's the unprotected sex and the untreated infections. Concurrency makes HIV and STIs move faster, not because of morality, but because of biology. And he admits that mass HIV communication lost intensity. Pop culture now moves faster than public health communication. The absence of credible youth-facing narratives has created a vacuum. At the University of Nairobi, located in the heart of the city, students opened up about the realities of their sexual culture. Male students admitted that when they sleep with another man's girlfriend, a practice they call Kugongeana or Kugongewa, they feel like kings.
Of course, na inakuanga lazima tu watu wafanye hivyo juu umejua mtu anasikianga kama champe. Kwa sisi kama majenzi mtu anasikianga tu fiti eti amegongea mse mwingine. Unajionanga tu champe tu, kuna vile watu ufurahi. Lakini personally mimi na mbogi yangu bado hizo story sisi hapana. Niko tu loyal kwako wewe, sina mwingine.
Mostly napata ni like it has come to be a natural thing. Kupata hiyo kuongeana mostly. Napata boys wako kwanza, hiyo ndio inakuanga sana. Unakuwa na boys wako, napata wameanza kuinteract na demo wako kiasi unasikia tu ushaongea. So kwa hii life ime affect mingi vitu mingi, kuleta magonjwa and everything like that.
Unaona kama tu atasikia advice kugongeana si mzuri. Kama tu kugongeana si mzuri juu unapata mwingine maybe anaweza kuwa na magonjwa na wewe una, si ndio? Unasajipata babaya kesho unahangaika. Una lose na maisha yako. Lakini mimi na advice tu waje story na kugongeana.
It's an ego thing. It's aura farming. They've taken something that belongs to someone else. The risk? They don't think about it in the heat of the moment.
Hapo sasa ndo inabidi mjichunge sasa. Hapo ma stories za kugongeana sasa. Hapo ndo inakuwa mbaya sasa. Juu tena unaamka tu asubuhi unapata unakojoa damu. Hiyo story hapana. Hapo ndo kwa kugongea ndo saa zizi. Ujui mtu ako aje. Ndio maana anasema mimi naye first nitakusorora tukiendelea kuongea nikujue fiti. And then after hapo tutaendelea. Lakini nikipata wewe ni wa leo na kesho asubuhi unataka ukuje ya yuezi.
Tuzi watu wanaangalianga pesa in relationship. Hakuna royalty sana, ni pesa tu. Kama una pesa utaongewa tu kawaida tu. Vibaya sana. Mostly kuna boys wangu hapa nikaongea. Nikaanga tu naturally tu aliajanga boys fulani hapo walikuwa na interactor demo yake sana. Ati besti chupui hivyo tu. Jamaa kutembea tu ikawa shida bana, huko chini anaumia vibaya sana.
Because unaweza pata mtu wako loyal. For example, let me talk on my side, I'll talk on behalf of girls. Unaweza pata girl ako very loyal, but the boy ana cheat. So you see, for a girl it's easy to contract diseases than a boy because the boys produce and we receive. So it's not good. To me si poa. And inachangia sana ku spread the diseases.
Condoms, most don't use them, even with someone they just met, even with someone they've never tested. Instead, they use a crude method they call kupima na macho, sizing up a person's health by looking at their body features and physical symptoms. If someone looks clean and healthy, they assume they are safe. They admit it's stupid, but that's what they do.
Mambo na kondiko hiyo inakuwa ni ngumu. Kama tu unajaribu kadem kama unajua ndio utumie kondiko, ina depend venye umeona dem anakaa aje, si ndio? Na maybe kuna dem anakuambia sijui maybe mimi unajua kuna hiyo nini anakuambia I'm allergic. Ako allergic na kutumia kondiko. Alafu wewe bro unaona kuliko hiki kitu iende. Wacha tu nishughulikie venye anataka. Inakuwa tu ina depend tu na venye umeelewana na demo mwenye umempata kwa sahihi.
Hapo sasa unajua ni macho tu inampimanga juu unaendanga yeye chenye unaenda kupima utapata. Sasa ndio hivyo tu hiyo. Sasa hiyo ndio watu huogopa tu hiyo chenye unaambiwa tu chenye unaenda kutafuta hapo hiyo unaenda kupima hapo utapata. Sasa hapo mtu unasemanga acha tu nitumie macho na nifunge hivyo tu. Sasa okay, ni sawa ni vizuri kupima naye inafaa, lakini mwenyewe najua tu tuko sawa tu, si hatuko wagonjwa huku nje. Hatujaonyesha hata science nini. So tuko tu sawa tunasonga.
Female students add that the phrases they use say everything.
Someone say, oh, huyo nimemark nitamgongea da. And it happens,
Do you think such a free life, a free culture ina affect maybe the spread of diseases kama STDs, HIV?
It does. Yeah, because if you don't trust your partner, if you engage in such activities, there won't be trust, and you can infect your partner. You can infect them with diseases like gonorrhea and stuff.
Education campaigns happen on campus, but most students don't take them seriously. It's just another lecture until someone they know gets sick. Then it's too late.
I can tell such people to just be careful when you're going out. Don't drink too much. At least just be sober enough to take care of yourself, because you never know what may happen when you get drunk. Someone can just take that as an advantage to misuse you. Tomorrow you may wake up in the morning, you find that you're having infections, diseases, you're having HIV. Yeah, so just take care.
Kupima na macho yangu ni kuangalia tu standards zangu kwa msee, na nikipata ziko sawa so naendelea, but nikiona tu standards si fit hiyo mdem, naona tu namchuja tu hivyo na naacha story zake naenda kwingine. Advice naye watu wasikiangi. Ni mtu tu ajichunge tu mwenyewe, aamue vile anaishi maisha yake, ajue tu vile anataka kukaa. Hata ukimadvise sahi, hata nimwambie sijui afanye hivi ama afanye kama mimi hatafanya. Juu kitu mtu naye mtu anachukia ni advice. Eti unaangalia hata mimi mwenyewe ukiangalia tu mtu sijui anaanza kuniambia unajua unafaa ufanye hivi na hivi, huwa unasikia tu hauko comfortable tu, mtu anaona siwe ni maisha yako na mimi ni yangu, so iko hivyo tu. Advice naye watu wasikizangi siku hizi, not unless tu ni mzazi ndio mtu atasikia. Sasa hata nikianzambia msee kitu hapa sahi atafanya.
Dr. Goody Gore sees the consequences every single day. She doesn't think young people are afraid of diseases as they should be.
As a matter of urgency, we need to sensitize. We need to sensitize our population. We need to have surveillance, and we need to have screenings. Once we have screening and surveillance, we're able to keep up with the trends that are going on. Then we should be able to have hospitals that are equipped with lab reagents that can test these things at an affordable price, or at least SHA should be able to cover screening of STDs. Once we have screened, now when it comes to the treatment, come with your partner or your partners. Hospital, I understand that they're human beings, but the people who work there, they are trained to do these things. So believe me, I'll see you and I'll forget you as soon as I see the third patient. So I'm not going to judge you or talk about you. I will not even remember you. Come, get treated with your people, and then go away. So if you do surveillance, screening, sensitization, treatment that is backed by law, availability of reagents and medications to diagnose and treat our patients, I think we'll go very far. Yeah, we need to take away the stigma from STDs. It's not something that we should be proud about when we talk about it, but it's a growing problem. We need to talk about it honestly and openly if we actually want to get to the bottom of this issue.
She sees patients presenting with multiple STDs at the same time: chlamydia, gonorrhea, syphilis, all at once.
Gonorrhea, herpes, syphilis, trichomonas vaginalis, chlamydia, HIV. We see them a lot. But what I see, because since I'm in surgery, the patients that we see with the diseases are usually gonorrhea. So a lot of men, what happens is that you see a male urethra, it has many functions. Apart from just passing urine, it's also used for ejaculation. So when you have gonorrhea, and people, they literally tell you they are peeing fire. So once you start peeing fire, just go and see your doctor immediately. Don't wait, because the minute that fire converts into pus and you start passing pus, in fact, even if you don't pass pus, the minute your urethra is inflamed, it's swollen, it will heal with scarring. That's just how the body heals. Very few places in the body doesn't heal with scars. So majority of the places will heal with scars. When it heals, it closes up that opening. So you cannot pee and you cannot ejaculate, meaning that you'll not be able to pee, and you've also become infertile. So for those patients, what we have to do, we have to take them to theater and put a catheter, urinary catheter. It's a pipe that we put directly into the bladder, which is below your navel. We put it there, and then you'll be passing urine through there. Of course, there are surgeries that can be done to correct it, but those surgeries are not 100%. A lot of those patients, actually over 70% of those patients, those surgeries are not successful, and you might end up staying with that urinary catheter for the rest of your life. So that is just gonorrhea. Now imagine if you talk about each and every STD, it can take us hours. So it's very careful for you to know the way when you're eating, you're careful about what you're putting in your body. It's the same thing with sex. You need to be very careful.
We have to bring the religious leaders, we have to bring the parents, we have to bring the educators, we have to bring the learners, we have to talk to the young people themselves in a language they understand. And more often than not, there is where we have been having a gap.
Because they've had multiple partners, no condoms, they've never tested, society has normalized immorality to the point no one blinks.
Actions have consequences, and sometimes those consequences are really detrimental. And these things, it will cost you life, it will cost you money. I know sometimes it's very tempting, but ask yourself, would you rather have sex for 1 year and never again, or to have good sex, safe sex for 50 years? Really, the choice is not very hard if you think about it that way. So before you engage with any partner, worry about yourself, worry about your body, go get tested, don't be in a hurry, have protected sex as much as you can. Mungu hakupendi, siku yako itafika. Yes, so be very careful.
Her gory images, people call them extreme. She calls them reality.
So I think we need to bring back those gory pictures, because that is actually how it is. I'm sure if people are shown the pictures of warts and anal cancers and cervical cancers and how HIV patients are. When I was in school, primary school, they took us to Muranga hospital and we were taken to the ward that had HIV patients. And I'm telling you, I was scared. I started very late in my life because I didn't want to have those diseases. I wanted to be sure that when I'm engaging in a sexual practice, it's coming from a mature mind, and I know what I'm engaging in and what is expected of me. And that is something that the kids are not told. They're just told, if you're siku hizi they wanatu wanaambiana mimi nimekumak, I have to get lazima. So you see, it's part of the culture, but it's quite dangerous. Yeah.
Those gory images you talk about, they also perpetrate stigma and discrimination. If you had a patient suffering from AIDS in those days in your home, the patient was ostracized from society, kept away, just like what we were doing during the COVID epidemic. Because what? Because of lack of knowledge. But now we have the knowledge, we have the know-how, we have the science. And so there is no need of scaring people, but giving people the right information in a manner they can unpack it, that is unpacked, in a manner that they can understand. And it takes time. It's not an event. It's not a simple event, because behavior change has very many facets, and it needs to be enforced time and time again. Different approaches. We can try an approach today. Our strategy today doesn't work. We try and see what works tomorrow. We have to keep on doing that until we get it right.
Dr. Gore is a surgeon. She operates on people with blocked fallopian tubes, blocked vas deferens, and stage STDs. She is warning the nation we are sitting on a fertility time bomb. So many young people will discover in 10 years that they cannot conceive because they had chronic untreated STDs in their 20s.
They feel like STDs is just something you can take medication and you're fine. And that is true. We have curable and incurable STDs. So the curable STDs are like chlamydia, gonorrhea, trichomonas vaginalis. However, when you have them, they do cause damage in your body. For example, if a woman gets those three, or even just chlamydia, it goes into her uterus. It can cause infertility, because when it goes into your body will react by getting inflamed, meaning inafura. So once it gets inflamed, it starts healing with scars, and that leads to infertility. Sometimes the PID can be so bad, the pelvic inflammatory disease, that it actually affects their liver. So yes, you can take medication and you clear that disease, but it has left lasting effects in your body.
Here is what shocks her every day. She has never had a couple come to test for STDs before engaging in sex.
People are ashamed. They're not ashamed of talking about sex and having sex, but they're ashamed of the STD. You see, once you're having sex, you can't be afraid of pregnancy. It's a consequence. The same way, when you're having unprotected sex, when you're including in unsafe sexual practices, you are expected to have an STD. When you go to your doctor, you should not be ashamed. We went to school to train to do exactly that, to treat you. So when you come to us, be honest about it. Come with your sexual partner or partners, and then after that we are able to teach you. We are able to guide you, counsel you, treat you if it's a treatable disease, and then give you more guidance as you go ahead in life.
The cream of the country, the educated, the elite, they carry diseases and don't know it. She warns against kupima na macho. She warns against self-medication and using over-the-counter drugs. She pleads with young people to protect themselves and seek early diagnosis.
But nikiangalia tu hivi we unakaa uko sawa. Yeah, that is such a lie. It's such a dangerous thing. It's not true. You can find HIV patients who are looking amazing. They have good skin. Their nutritional status is excellent. Unaweza pata msee amekonda na hana magonjwa. So hiyo kitu ya kupima na macho, it's a bad thing. Dangerous, msijaribu.
She says that the government should now ensure that insurance and the much publicized SHA should cover STD testing. Douglas Bosire confirms that the overall response to the HIV epidemic is on course, but there is a new challenge, a new age cohort with new behaviors. Old tools don't work. The government must go where young people are, into digital spaces, into comment sections, into the apps they use every day.
Young people need to be given a reason to act. They need to understand why it is important to take certain deliberate actions to protect their health.
Dr. Patrick Amoth admits mass HIV communication lost intensity, but he insists the government is adapting. This is not a morality tale. This is a public health emergency, and it's unfolding in bedrooms, in clubs, in university hostels, and in the DMs of people who thought they were invincible. Bosire's message to young people: freedom without information is vulnerability. Protecting your health is not fear, it is power. Know your status. Use condoms even with contraception. Test regularly. Test STIs early, because loving your life includes protecting it.
Our aspiration, our dream, our vision, our goal as a country is to end AIDS as a public health threat by the year 2030. That will no longer have new HIV infections. That the few people who will still be living with the virus can live a healthy, full life without developing the AIDS as a disease. So that's our hope.
Ask yourself if it's worth it for you to become infertile for a partner that doesn't even care about you, or their care for you ends as soon as the sexual act has ended. And it's important for people to know that this is not to shame them for having sex. Sex, it's for adults. We should all have sex, but I think we should have safe sex. We need to practice safe sex, be afraid of diseases, and have enough self-love not to be carrying around STDs.
And if we as parents are not talking to our children, if our teachers and our educators in the schools are not giving life skill education and sexuality education to our young people, because that's where our young people are spending most of the times, then these kids, these learners and these young people are growing up devoid of information. That pressure, that peer pressure is there, it's real. So it is incumbent upon us to really give these young people information, and knowing that these young people have the ability, have the capacity to make their rational decisions that put their health first. That is the urgent call that I will make.
The battle for the health of Kenya's future is not just in clinics or policy papers. It's in the group chats, in the comment sections, in the quiet conversations between partners. It's a race to fill the vacuum with the truth, to equip a generation with knowledge as powerful as their freedom. The question remains, will they listen before it's too late?
Choose the right partner for you. Go get tested. Watch your story a moment. You can get that moment anytime if you're a healthy human being. go get tested, know that you're safe with that person, and then go ahead. Unless you know that that person will give you HPV and they'll stand by you when you get cervical cancer, when you cannot give birth, you're barren. Can you imagine getting an STD from someone who didn't care, and then when now you're married, you can't give your partner a child, or you cannot have free sex the way you don't with your partner because things inside your body just don't work the same. Sex is momentarily. Even if you love sex, you can't have it for 24 hours. You'll get tired at some point. You'll have to do other things. So don't just focus and fixate on sex and how much you can have. It's okay. So long as you're having safe sex, well and good. But if it's not safe sex and you're taking a risk, it's not worth it. Even 0.5% of risk is not worth it. Imagine getting HIV. Will that woman still be that beautiful? Will that nyash be that valuable? You know, for women who talk about big dicks, is it going to be worth it after that? It's not. You need to have patience. Maisha sio easy. Decisions ndio easy. Consequences ni ngumu.
There's hope that all of us, all of you are going to grow up to be young, productive, men and women who will lead this country. Of course, you are leading, and we have seen by your actions. The fact is that the threat that is posed to your health by the HIV virus is real. It's not over. And you have the ability, you have the know-how, you have the capacity to take charge of your health. Reach out, and if you could not be able, then also reach out to us so that we can walk this journey together, because indeed we need a future of Kenya which is HIV free.